Dr. David Schiller, and we're going to be talking today about why your gluten-free diet isn't working. We take care of a lot of autoimmune patients in our office, and for most of them, you can almost guarantee that they have a a gluten sensitivity. I have actually stopped checking for gluten when I know the person is autoimmune, and I can tell them with confidence that they should be gluten-free. Many people come in knowing that they should be going gluten-free, but they tell me, well, I tried gluten-free and it didn't work. And there's a few reasons why that is happening. One, there are foods that you could be eating still that can trigger the gluten sensitivity. These foods are called cross-reactors. So there are foods that will actually trigger your gluten sensitivity. So if you have not eliminated all the foods that you're sensitive to, then you're going to always have this problem. So it's not the fact that you're going gluten-free that's not working. You're just not doing it appropriately yet. So you need to find a doctor that understands these cross-reactors. These are called epitopes. An epitope means that you can be eating a food that actually can fit into the gluten antibody. And the most common ones are millet, yeast, corn, instant coffee, oats, rice, dairy, soy. There's actually a lab that you can go there's a lab test we can do that actually can test for all these cross-reactant foods. So not only may you be sensitive to those foods, but when you eat those foods, this one lab, called Cyrex Labs, actually checks to see if they are cross-reactors. So a person may say, well, I went gluten-free and it didn't work. Not if you eliminated all the foods will it work well. The other reason is that you could be eliminating these foods, not only gluten, but these other cross-reactors. You heard about this concept, and you actually went through elimination diets, but yet you eliminated the foods, but yet you're still feeling bad. And the reason is you need to repair that gut. When you eat foods that you're sensitive to, you produce so much inflammation in the GI tract that the gut becomes leaky. Leaky gut syndrome is real. It's now seen in the mainstream literature. So you must realize that if you don't repair the GI tract, not only not eliminating the foods, but then repair it actively, and that doesn't take a short amount of time. It could take months and months to actually get a full repair going. You may not get it ever fully repaired. The reason is that you're constantly exposing yourself, you think you're doing okay, or you haven't reestablished good bacteria in your gut. There's all different reasons why the leaky gut can persist, and unless you repair it, it could be another reason why you're not getting the full effect of your gluten-free diet. So keep these things in mind. You need to find a doctor that understands these concepts. You need to not only find out if you are gluten sensitive, if you are autoimmune, you can almost guarantee that you are. I mean, I've yet to see someone who wasn't. There's always that chance that you aren't, but there's only really one test, and I'll talk about that on the next post, is how you really go about finding out if you're truly gluten sensitive. So if you are gluten sensitive, are you now have other food sensitivities due to the leaky gut that you produce because over the years you were just eating all these foods that were inflaming your gut, causing leaky gut, making you more and more sensitive to more and more food categories, and without the repair to that gut, you consistently have not the best results by going a gluten-free diet. So I hope this information helps, and look for our future posts on similar topics, and I hope to see you soon potentially, and make it a great day.